Lot of time, so we'll have Dr. Vinay talk about the EMR and the TPA empanelment. Dr. Vinay works, I mean, he owns Synergy Eye Hospital, which is a very good model for practitioners who can use the facility. And I think this is one of the pilot project, I would say, in Delhi NCR, which Vinay has put up. So Vinay, we'll hear about the EMR and the
Yeah,
TPA.
so I think before that, we were talking about passing the exams, right? So when we were also medical students, हमारा ध्यान होता था, somehow we should pass the exams. And now we are reaping the benefits of passing those exams. So when you start with NABH, you are only bothered somehow you should get that bloody certificate. But once you have done that cycle a few times, I've done it already 3 times, we've been there for more than 9 years, then you start actually reaping the benefits out of it. So, you start with passing the exam and then you start to top it up. And next time when the counselor, the people will come and say, boss, this is extra that I'm doing beyond what you're supposed to do. So right now consider not passing the exam, but later you really reap the benefits of it. So that's the analogy that I'll say. So now coming to the talk that was assigned to me about EMR and TPA. So I mean, today the hospital industry is not a hospital industry anymore. It has become more of a hospitality industry. We can do our premium practice not only by putting the so-called premium IULs. It is the premium services that the patients require. Now, IUL is a very, very small part of the overall experience that you're giving to the patient. So everything has to be taken care of for the patient. And of course, the quality is a given. Now, I mean, I was talking to someone. He says that never talk about quality. Don't talk about what you can show. So quality should be seen, not should be talked about. And going cashless and paperless is two ways in which you can make the patient's life easy. And that's how you can win their hearts and also make them open up their wallet for you. So I'll be talking about TPS to begin with. So in an ideal world, we should not be having a cashless because there's so much of a pain that we have to take care of. Patients should pay, we are giving them a service and they should get a reimbursement. But unfortunately, we are not living in that ideal world. It may not be a very practical solution. In fact, avoiding cashless may also mean less cash for us because as someone was saying that people will tend to go to a place which is offering them a better service because there are so many options that the patients have. So better we adopt it early in our practice rather than someone else, your competitor adopts it and the patients run away from you. So what you need. So as Ashish was telling, we should be registered with the local health authority. That is very, very important. That is anyway important for us for the legal point of view. And to answer your question also, sir, I mean, we have been practicing for so many years with possibly without any legal licenses and all, but it's a good idea to know the law of the land, what is the norms that are to be followed, and if possible, we should try to follow those norms. So it's never too late to start to follow the norms because if something goes wrong, then the people will come and they're going to look at the documents. When everything is going on right, no one bothers about it. You may be doing it from a basement of a dingy room. We used to operate in camps, we were operating all over the place, but now we're not allowed to operate in the camps. So better to follow the norms. And that again, if you're going in for a cashless, you have to make sure that your center is duly recognized by the local health authorities. The medical facilities are adequate. All the legal compliances are in place. Preferably QCI or NEBH is what they prefer. So there has to be some safety mechanism, some quality system should be there. And you need a dedicated staff to manage all the extra paperwork that is required because as a professional, you would not be able to do all these things. So someone to take care of empanelment, pre-authorization, billing, follow-up, etc., etc., etc. So it's a lot of work. The new scheme about cashless for all is there. So if you don't have a tie-up with a particular TPA, the IRDA has come out with this thing that if you inform them 48 hours or more so in advance, the insurance company is going to connect with you and you will have a agreement for that particular patient. Okay, for that particular patient, you are going to be given that much of amount. So you should have all the paperwork ready for that so that whenever you are sending them, they'll be asking for some documents. So keep those documents ready with you and try to negotiate and get the better rates from the patients. So that's one thing. Some helpful tips is that you should have a well-defined tariff list. So that has to be shared with the TPAs on a regular basis. They often don't revise their list, but it's your job to every time you revise the tariff list, send them a copy. So at least you have done your job of informing them. The accounting has to be preferably digital. And if EMR is a kind of a must for doing all the TPA works, though you can do for a small level, you can do without EMR. But as you grow bigger, you would definitely need them. And many of them prefer digital upload of the bills nowadays. So there's all online portals from which you can do that. a dedicated staff that I already talked about. You need an accountant to take care of making the right kind of bills for them and chasing them for the payments, to reconcile the payments and so many things. And sometimes the challenge we have is that if you're going for so-called premium lenses, they are not covered, then you have to make sure that you charge that extra from the patient with a proper documentation. There's an undertaking that you take from the patient saying that, okay, I'm paying this thing on my own volition, and I know that I would not get reimbursed for that. So all that paperwork has to be complete. Otherwise, you create a lot of challenges with the TPAs. So anything about the TPAs, if anyone has a question, because before I move on to the EMR. So the way I do at my place is I never promote upgradation. I say, okay, sir, you're authorized for this particular sum. We will put whatever package we have in that, and it's a decent enough lens. So there's no problem in that. Of course, your insurance companies has a tie-up. They are not going to pay more than that to us, and this is not a bad lens. If you want, that's an optional thing. I won't recommend it, but if you really want it, then as a favor, I can do it to you. But then you have to do this thing. So if you don't push it, the patients don't bother you as much. If you push it, that's when the patients start to bother you. Of course, that's a very, very gray zone that causes a lot of misunderstandings, but that's the way it is.
So then the problem is you are not able to promote the toric and the multifocals.
You should never promote the toric or multifocal. You should give them as an option, but you should never promote. The difference is promoting and giving it as an option. The moment you push it, you will be on the back foot. The patient is not happy with it, he's going to come and eat up your head. When the patient asks for it, then you are much safer. So I personally don't promote it, I give them as an option. Now you have to give it as an option because sometimes people will come back and say, you never told me about this. So an option has to be given. The pros and cons have to be told. I sometimes emphasize more on the cons than on the pros because pros patients anyway know. And I want patient to ask for a multifocal or a premium twice from me. Yeah, toric I definitely promote because I say toric is a benefit, but multifocal or anything, I would ask patient to ask me twice, but again, that's my policy, how I push it. So if you push something, the patient will think that you are benefiting and the patient will grab. If the patient asks for it, you are going to be in a safer space. So that's my personal philosophy. So coming to yeah. Yes, sir.
Not good experience with TPA. I was attached to the TPA.
Nobody has, sir. Honestly, nobody has. So as I said, ideally speaking, there should be a place where the patient pays us for the services and let him take the money from the insurance companies. But unfortunately, that is not the ideal situation. So we have to see how best we can manage that.
And sir,
But
just
they
one
never
question.
passed my paper. And when I phone call them, nobody is available, that officer. I stop.
Sir, that is a norm.
I don't
there.
practice TPA nowadays. Just,
Perfect, sir. You're in Bombay. You're lucky. We all are envious of you people.
So I think most important thing, every doctor should unite. We all should unite and stand
That's
against
not
these
going to
TPA companies, which
happen. That's
doesn't
not going to
happen. So
That's not going to happen.
yeah.
Chalo.
So coming to the electronic medical records, now I think it's not something that we need to discuss anymore because that is a given now. I mean, if you are not in the beginning stage of seeing only 4 or 5 patients a day, there is no reason why you should not have an EMR. So electronic medical record is a must nowadays. So it's basically a collection of whatever patient's medical data in electronic format. It basically has demographic data of the patient, so that is very important. So you have got his name, age, sex, address, phone number, maybe his birthdays and other things. The histories in that, examination findings are all mentioned there, and for ophthalmology, we are looking at a specified EMR because we have got a lot of parameters that we measure compared to the regular EMR that are available for the other specialties. If possible, a drawing tool is also very useful. So this is the kind of a drawing tool, the way I am right now drawing on the iPad, so you can always have a drawing tool, and these things can be linked up to the patient's file, so you can draw the retinal diagram, corneal diagrams, and all those things. So basically, you can either maintain the data in-house, or you can maintain it on the cloud. The cloud is nowadays preferred because the data is much safer there. The only downside of cloud is if the internet is down, the things kind of go kaput. But then as you can always have 2 internet connections, and someone told me that even the biggest of the banks are working on internet. And billions of dollars are being transacted on internet. If the internet is down, server is down, everything stops there also. So that's all right. We have to take that chance. But having it on the cloud is the better option. Other thing that you may do is the hybrid option where you can have it on the cloud and a small thing on your local server also. So even if the internet is down, you can still work. It can sync with the cloud later on. It connected to the computers, tablets, or mobiles on a network, and it can be accessed from various places by the different people. So different people will do their different entries, right? From the person who's giving the appointment to the person who's doing the registration, taking the payment, optometrist, your assistant doctor, you, counselors, everything can be interlinked. And it gives you the backup and retrieval of data. Now, what are the apprehensions that we used to have? What's the need to change? I think that part is gone now. I think we all agree that EMR is a must now. It is expensive. Yes, it is expensive in the short run. It is an expensive investment that you're going to be making, but in the long run, it's going to pay back multiple times of its value. A technical staff is definitely required to manage your systems. One person is good enough for that, but now most of your staff are very tech savvy. They have been working on the phone and tablet, so they can take care of all the things. Initially, it is a bit difficult to train the doctors. And doctors are more difficult to train than the staff because staff still is more malleable. The doctors are the ones who are used to our own scribbling. So you have to kind of push them. So in my center, I used to be using EMR because I'm blessed with a bad handwriting, so I had no option but to use an EMR. My partner was not using it, but when NABH came in, we had to adopt to the EMR. So I think that's also helps because the amount of writing that you have to do otherwise, there's no other option but to go for EMR. It slows down the workflow in the beginning. But the advantages are you give a printout as a prescription. It is more legible. You can add generic name to the medicines. You can give alternative names to the medicines. So that way it becomes much more legally compliant because the government will ask you're not going to be writing brand names. So you also write the generic name. You also mentioned that you can replace that with another brand also if you want. So all those things can be done on an EMR very easily. With hand, you cannot write everything, Ciplox eye drops, bracket ciprofloxacin 0.3% eye drops. That becomes a pain. So EMR, everything is all automated. It can be bilingual. It is much more impressive to give a printout to the patient and legally much more safer because you maintain a copy of a record. So this is very important. Important part about EMR, it should be the kind of EMR which should not be editable afterwards. Because if your EMR is editable afterwards, it has got no legal value. So you should not be able to edit it. And even if you are editing it, there should be edit record is available. That's important for the financial records as well as for the medical legal records. So this is also very important when you're making an EMR for yourself. The legal compliances and NABH, cashless I've already talked about, minimizes the mistakes, minimizes the illegible handwriting. Possibly the jokes about doctors' handwritings would be of something of the past. So better patient satisfaction, much better, and better records retrieval. So patient comes to you, you have got the whole record with you. You can tell them, okay, last time you came on 24th of December last year, how have you been doing? Last time you had this thing. So by the time the patient enters your room, you have gone through his medical record very briefly. And when the patient comes, you start a conversation from where you left last time, 6 months back. So that really helps to build the rapport with the patient also. So in the long run, it does save a lot of your time. You don't have to go through all the papers because everything is there in front of your screen in a very well organized format. Unlike when the patient gives you all the prescriptions with the receipts and this and that, it's a messy affair. So on the whole, it saves much more time in the long run. You have a financial control, better patient engagement, patient education, patient retention can be better. You can use it as a research tool. So you have a predefined format, so therefore it is especially useful for the NABH where you've got all those multiple things to be written. Some of them are pretty useless ones, but yes, because it's an EMR, it's okay. You have to, for every patient you write, you have given an advice about nutrition. Now with the hand, you cannot write that, right? With the EMR, the thing can be just printed out there. So it's a huge time saver in the long run. And you can advise follow-up schedule to the patient. So whenever you're given the schedule, the patient gets a WhatsApp message 2 days before the next follow-up schedule. Patients are more likely to come back to you. That's where you get your revenues also from the patient. Patient also benefit because they're getting better follow-ups. Their disease management is getting better. You can integrate with WhatsApp and email as Achal was talking about. So that also works in your promotions as well. Now, HMS or hospital management system is a step above the EMR where you've got a comprehensive solution where appointment, billing, accounts, counseling, IPD, pharmacy, lab, patient engagement, CRM, all the audit compliances, everything is kind of taken care of in a hospital management system. Purchase, pharmacy, HR management, finance, revenue management. In fact, in my place, I've got about 25 doctors who are using my facility. So for every procedure, every patient seen, that doctor's name is recorded, what percent share that doctor is going to be getting for that. So they have a dashboard where they can see for every patient how much money are they getting paid. That adds a lot of transparency to the system. They also can see how many patients are credit patients which are pending. So they know these are the patients which are operated, how many days since the surgery, how much payment they have received, what is their share. So everything is very transparent. This is only possible if you've got an EMR. And waiting time on monitoring you can do with the patient, so you can improve the patient experience, and you can define the rights for the various users, so you can know who can do what all entries. So how to start is that you have to choose the right EMR for you. This is very, very important. And a single practice with a OPD of 15 to 20 can go with a simple EMR. But if you've got a bigger setup, you should go for a hospital management system or EMR which has got an option of upgrade. The vendor should give a good service. Service is very, very important. So don't just go by the cheapest guy. Go with someone who's going to be giving you good service in the long term. Don't do any customization initially. Initially, just go with whatever the EMR is offering you. Tweak your systems initially. Once you're comfortable with the EMR, then you should go for the customization later on. Once you understand the systems better, once you know what exactly you want. Otherwise, you will be in a mess if you try to customize it right there and then. Right? And as I say, selecting the EMR is like a marriage. You should be very careful which one you select, because the divorce is very messy. Because if you go from one to the other, all your data gets lost. So you have to be very careful whom you select. Don't go for the cheapest one. Go for the one that suits you best and who's going to give you the better service, which is compatible with you. Initially, don't give up on the paper, because the things will crash. You would make mistakes. So have a backup of a paper initially. Till you get confident, then you stop paper altogether. Make sure you have got a well-defined backup system in place, because the things, if anything can go wrong, it will. So you have to have a good backup system, because once you are totally reliant on that, you have to take a backup in place. Train the doctors and staff, reward them for adaptation, and start slow. Don't use everything on the EMR at the beginning, but then slowly you can start building up from there. So this is what I've done. I think we are short of time. So I've just integrated the EMR with the WhatsApp appointments and everything. The patients get automated messages. Then they get the locations. Pre-operatively, they get all the information about what all they have to supposed to do. If they put on a disease, they can get the information of the disease on the WhatsApp. So everything we have done a integration. So this is my phone number here. If you can just send a WhatsApp of hi, you will see how the whole automation of WhatsApp will work. So you can just take a demo of that, or visit my website. You can just click on the WhatsApp, just send a single message, hi. There will be a whole loop of messages that will running through. So that's where the patient engagement also helps. When the patient is sitting in your OPD, he's going through some literature of yours. So that's where it helps. You can also make an app that we have made for the EMR link, so patient can see their own previous prescriptions, next appointment, they can book their appointments, everything can be taken care from that. So I think this is where I end. So after talking about making it cashless and paperless, there's another thing that we can talk about is how to make your growth effortless. So I'm basically writing a book which is Beyond Vision, how we can improve our growth by increasing patient loyalty. So these are some of the chapters that I've written. It's going to be coming in a month or two. So patients will chase you only if you don't chase them. Yeah, okay, fine. So thank you. If there are any questions, I would be happy to answer. Sir. No, it's not that it's not acceptable. It is acceptable. It's much more tedious. So if you have a patient base of more than say 10, 15 OPD in a day, I think it's sooner or later you must go to a EMR system, because that is the amount of legal compliances are required. It's much better to retrieve the data from there. Your prescriptions are going to be much more legible, much more in line with what the requirements